All right, guys. So as far as our dilution, everybody does it differently, and I believe like I'm so respectful of everyone's technique. I always have love and support for everybody. I don't think one provider is better than the other provider because now they use more still water. So I don't judge anyone. I just respect everyone's technique, and whoever your mentor is or whoever you're comfortable to learn from, just stick with them. One thing that can be super confusing, especially when you're a beginner, is like learning from this person and that person, and then you're getting yourself so confused. So I have learned my sculpture from Dr. Shinobe, and I have shadowed him for 3 times. I attended his master course in Fort Lauderdale for the first time, and then we hosted his master class here in DC, and then he's coming back again August 18, and it's going to be 2 days of training. And his belief is that perhaps he's a dermatologist, therefore he has so many modality that can help his patient with improving the skin quality. But one thing he doesn't have anything beside his Sculptra to help with maintaining the bone structure. I think whether it's energy devices that we have, whether it's old therapy, Morpheus 8, uh, Fraxel, Thermage, there's all these energy devices out there to improve the quality of the skin. But in my humble opinion, I don't know much anything besides Sculptra that can preserve my patient bone structure. And bone support matters to me because one thing happening during the aging process is, especially women, we have smaller bone to begin with. Two, women during menopause, premenopause, hormonal changes, one thing that we lose 30% is the bone support. So therefore, I'm going to do anything I can to help my patient to preserve their bone structure. I can give them volume through filler. I can give them skin tightening through the energy device Morpheus 8 that we have. But in my mind, I don't have anything else to help them with the bone. So my injection is a little bit different than Brittany, and my injection will be just focusing on the bone. So when I do my assessment, I always tell my patient, like, look, I'm going to treat you like a clock. You're going to go all over the place. I'm not going to just make you look young and healthy on your upper face and neglect your lower face. And the one thing you guys will see is so typical. Look at women in their late 60s or 70s. Everything looks amazing here, and they're literally, covering their neck and the scarf because somebody neglect their neck. So if you are an artist and this is your art, you have to pay attention. You have to treat this like a whole. You're not going to just draw a nice painting and then ignore the corner of the painting. You want to paint all over. So always remember, this is a clock as far as your neuromodulator, as far as your filler. Quickly, over neuromodulator. I know everybody knows that, but I'm just gonna focus so much on it. I will turn it on when it's ready. Yeah, I'll turn it on. So upper face, mid face, lower face. If you only focus on the upper face, your lower face muscles are depressor. That means they go down. So why would you relax someone here and then neglect the lower face muscle when we know the lower face muscles are a depressor? I feel like it should be the other way around. We have to relax things that they go down, as a matter of fact. And interesting enough, the majority of the lower face muscle, they require just a little bit of a toxin. 3 and 3 for DAO, Mentalis 6 to 8 units. So be mindful of treating your skin as a whole. Dermal filler, I love them so much, but it's not enough. It's like the simple example I use for my patient is like we want to bake a cake. And if you want to have a delicious cake, you want to use all the ingredients. You're not going to just use sugar and milk and call it a cake. No. So if you're trying to create a non-surgical prevention of a treatment for your patient, you need your neuromodulator, you need your dermal filler, you need your skin tightening, but you need your biostimulator. Otherwise, in their 50s, they're going to look off. And I will promise you that because you can see that. They're walking around every day. Again, big lips, no pre-gel sulcus. The mentalis is lifted upward. So this doesn't even have a support. Big cheeks and a hollow temple. And then obviously, as we age, female forehead should be nice and round. As we get older, a female forehead becomes more like masculine. It becomes very flat. So non-surgical frontoplasty is one of my very favorite treatments because I love to replace the volume loss. I love to replace the deep fat compartment for my patient. So for her, if you look at her face, go ahead and look down a little bit. So the position of the eyebrow changes a little bit because when we're young, we have lots of volume here. As we get older, we lose this volume. And this is why, again, compared to a nice round forehead, if you look at all the models, they have such a beautiful forehead. It's nice and round. So it becomes more flat. We lose the deep fat compartment, especially, go ahead and look down. You can see that she's extremely hollow in this region. Right there, you could do a non-surgical frontoplasty to give her some volume. But we're focusing on biostimulator, so we're going to focus to the temple. But keep in mind the forehead is so important. If you neglect the forehead and temple, your patient's going to look like a 30-year-old here, and they're going to look like a 60-year-old here. So for everyone who wants to look natural, I'm like, well, you already look fake because you look like 30 here and you look like 60 here. So educate your patient, you know? So temple, why is it so important? Lateral canthus. The brow lift, yes, we can give them some brow lift through injection of toxin, but when you lose this support here, the corner of the eye goes heavy. And this is why everybody want to look like Bella Hadid. They're like, I want just a little bit of a lift here. I'm like, sweetie, you need a lot for that. You know, one PDO thread can't do that. So temple is so important because when they're so hollow here and they have high cheekbone, there's not a nice projection. There's not a nice camouflage. It looks from like depression projection. That's not smooth. That's not soft. So you want to always assess your patient's temple. Her temple looks great actually, but I'm just bringing that on you to your attention because that's how you're going to give them some lateral support to the orbicularis oculi muscle and helps them with the lateral canthus, especially the corner of the eye. And as a matter of fact, it's going to help to open the eye a little bit. She has a beautiful cheekbone. One thing you guys want to pay attention to, so patient either have a beautiful high cheekbone, but they're hollow on the mid face, or they have volume on the mid face and they're hollow on the lateral zygomatic bone. It's either or. I have never met someone to have both of them. Like me, I have lots of mid face, but I don't have the lateral zygomatic bone. What I want is the bone. So talking about the nasolabial fold, is this a true nasolabial fold? Is this a smile line? The smile line, go ahead and smile for me. Smile line is meaning repeating the same motion in one area over and over and over and creating this crease. That's a smile line. Nasolabial fold is because our mid-face support has been, our cheekbone doesn't have the support anymore, meaning this deep fat compartment is hanging on the wrong area. So by giving her a lateral support, we're going to get rid of this thick fat or this heavy tissue from down to up. So in addition to that is the piriform aperture. We lose this deep fat compartment here. So by placing our Sculptra or by placing some dermal filler, we're going to give her some support. Second, the LLS muscle that is responsible for lifting the lip upward, we're going to give that muscle or that region some support, so definitely we're going to help with prevention of and
There's another thing that's plugged in there, right?
why do you guys think the older patient is going to disappear? One, a maxilla, the bone. Two, lose of the deep fat compartment in this region. Three, this area. So angle of the mandible is going to contour her face and is going to also help with all the soft tissue that she has. All right, so first I'm going to start with her mid-face and her lateral zygomatic bone. And then temple, piriform aperture, pre-gel sulcus, and angle of the mandible. So if you, alrighty. So my dilution, it is 6 to 1, so it's like 6 ml of water and then 1 ml of 1% lidocaine, never with epi because of the blanching. So looking at the anatomy, if I ask you guys, what can I do to spray my medication on the bone? we're just trying to spray our Sculptra in this region. So it's a deeper injection. It's a deep fat compartment. And I know one thing Brittany mentioned, and it was so valid. Yes, plastic surgeon, they don't like lots of scar tissue because when they do a deep plane, it's just lots of scar tissue and they don't like that. But then at the same time, I love to help my patient to maintain their bone structure. So that's important to me. So I'm going to start with her mid-face support and the lateral zygomatic bone. So this is the area that almost I'm going to place my product to help with the deep fat compartment and then periosteum. So I grab the tissue. I am under the muscle. So I'm going to aspirate because I am deep. And I'm going to retrograde. So 0.2 to 0.3. I'm going to reposition and a little bit more like superior. Retrograde 1, 2, 3, 4, 5, as many seconds as you wish to be safe and feel safe. 0.3. And I'm going to reposition. I'm going to lift the muscle. I am under the muscle. And my last injection, 1, 2, 3, 4, 5 seconds. Right there. And I'm retrograding. So that's my first injection point. And again, looking at the anatomy of the zygoma, this is where I'm trying to protect the mid-face support. Then my next injection, it will be more like lateral. I'm going to inject in this region because I'm trying to give her this nice lift on the lateral zygomatic bone. So I lift the tissue. I go very deep, and I can feel the periosteum. So I'm going to aspirate, couple seconds, 4 or 5, as many seconds as you feel comfortable. And I'm going to retrograde. And then I'm going to change my position. I have 0.1, so I'm just going to place that there. So my injections are very deep because my way of treating my patient is this is my only chance that I can help with the deep fat compartment and preserving and helping with the bone support. Your patient will like that. Again, I spend a lot of time with Dr. Shinobe that I have seen his patient from when they were 65 to 75, that you can see the patient bone support looks so much better, especially through 3D camera. All right, so that was my first injection for this area. For the temple, go ahead and open your mouth big for me. So when you ask your patient to open their mouth, basically they're relaxing the temporalis muscle. Second thing, I always put my finger, I'm protecting the orbit, and I'm also putting my finger here so my medication doesn't go the other way, because this is the region I'm trying to place the volume back. So straight to the periosteum. I'm going to aspirate 1, 2, 3, 4, 5, 6. Putting my finger back so my solution doesn't move forward towards the orbit. And she's going to just keep her mouth open, and I'm going to put between 0.3 to 0.5. And then I'm going to come out slow. You can now relax. And then one secret that I'm going to teach you guys, when you're injecting, when you're coming out slow, you're going to have less chance of bleeding because you're closing all those layers behind, you're tamponizing. So therefore, less bleeding for your patient. My next injection point, it's the pre-gel sulcus. Again, deeper injection. I'm going to lift the tissue upward. Sorry, it's a little uncomfortable. So I'm on the mandible, retrograde, and this is going to be a fanning technique. So one injection, the second injection, and the third injection. I'm going to reposition. I would be using a little bit more product, but I have only one vial. So again, lift the tissue, because keep in mind, there's a ligament here. What happens during the aging process? These ligaments is what connecting the skin, muscle, fat pad to the bone. And as we age, what happens to the ligament? They start shifting downward. They're not giving the skin the support anymore. So also by replacing this volume loss, we're trying to give some support to that ligament. So I lift the tissue. I'm injecting very deep. I'm going to aspirate 3, 4, 5 seconds, however you're comfortable, and I'm going to retrograde. I can feel the periosteum. I'm very deep, exactly. So for the angle of the mandible, I just go straight to as posterior as possible, and I'm exactly on the bone. I'm going to aspirate for safety, and then I'm going to put 0.3 ml of Sculptra. And then the last injection point for me will be the piriform fossa. For that, I'm going to use the 25 gauge needle. Piriform fossa is important because one, as I said, as we get older, the distance between the tip of the nose or the nose and the lip elongates. Two, we lose this deep fat compartment. So there's a light and shadow, there's a projection and depression. So by smoothing this area, by bringing volume back to this region, it's going to get rid of this hollowness and it's creating a smoother transition. So I'm going to, with my non-dominant finger, I'm going to feel for the artery. I'm going to push the artery away, like away from the danger. And I'm going to go bevel down straight to the periosteum. I always do two-hand aspiration. Like I know it looks nice that we do one hand aspiration, but I think this is patient safety. Two-hand aspiration, you won't be wrong. It's what safety matters, and I think with two-hand aspiration, you're more accurate, so your needle is not moving. So 0.3, and then as I said, guys, I always come out very slow. Give this a try. When you come out very slow, there's a less chance of bleeding. So you want to have a clean field. The more clean, because one day imagine you're going to be performing for the audience. You're on the stage. Sometimes you go to these conferences and the doctor or a nurse is injecting, there's like blood everywhere. You want to be as clean as possible because that makes you different from so many other providers. So in summary, what I did for her was 0.4 ml of Sculptra for the temple. By supporting the temple, you're going to create a nicer transition between the temple and zygomatic bone. Second, it's going to support the lateral portion of her brow, and it's going to help to open the eyes as well. As far as the mid-face support, she can benefit from some augmentation or some volumization around the lateral zygomatic bone, because if you look at the models, the reason models look exotic, if you remove their makeup, they don't look that good actually. They don't. But then it's like the light and shadow and the angulation is what make them look so chiseled, so sexy. It's like they look like dangerous. So you want to maintain your patient bone support. Piriform aperture is going to support that L-cin muscle, and that's responsible for lifting the lip upward as well. And actually, when the nose, as we get older, our nose becomes wider. So by placing volume in this region, long term, you're going to maintain this support and you're going to help the maxilla. And then for the pre-jaw sulcus, it is super important because as we lose volume here, the corner of the lip goes downward. All right, so now for the other side, I'm going to have you guys to give this a try. So who wants to start with the cheeks first? Yeah. So keep in mind, if you look at the anatomy of the bone, look, there's almost like a W. Exactly like a W is 1, 2, and 3. So when she looks this way, you're always going to, it's like a breast augmentation. It looks nicer, it looks better because it's under the muscle. So, and keep in mind that with my technique and learning from Dr. Shinobe, we're trying to also help the bone support. So your injection will be like really nice and deep. So lift the tissue and then feel for the lateral zygomatic bone and her midface. This is where you're going to inject. And then, so that's her lateral zygomatic. So first going to start with the mid and then the lateral zygomatic. And then when you're grabbing the tissue, grab it from horizontal here.
So first injection point is here, deep.
And then hold it like that, you see? Who has a question? Any question? So I want to hear some feedback. What are your thoughts between how would you feel more comfortable? Are you more comfortable as far as if you were injecting superficial, or will you be more comfortable if you were injecting pre-osteum? Bevel top, yeah.
I like the deep because I feel like I would know that I'm wearing
And then go ahead.
deep
And then aspirate.
rather than like you're not supposed to be like a dermis, but you're not.
And then 0.3 there.
For me, like as a beginner, it's more confusing.
Yeah. So now you can change. That's perfect. And I absolutely, 100%. There's no right and wrong. Like, you know how we don't do our makeup the same way. We don't drive our car the same way. We all are comfortable with what we're comfortable. And there's no right or wrong in my humble opinion. I think so. I would say why not? If they're doing 2 vials, why not? So now for the lateral zygomatic bone. So you're gonna inject from here, and it's like basically think about what can I do to spray this bone? What can I do to introduce this beautiful biostimulator to the bone to help my patient to maintain? Who here thinks when they were younger their cheekbone was like more defined, and then as they age they losing that support? So this is all you're trying to do is you're helping your patient to maintain their skull. They maintain that bone structure.
So here, am I going 90 degree?
And then now from here, go ahead, lift up the tissue, 30 degree, right there. And now go ahead with 2-hand aspiration. I love like my colleagues that they do and retrograde. 1-hand aspiration looks extremely cool. I love it. But for me, my patient safety, it looks more cool to me. 2-hand aspiration, because even an inch when your needle moves, that's a false aspiration. So we're gonna now. Who wants to do temple? Okay, yeah. So
You guys have done this before.
they're like a very professional nurses, absolutely. So go ahead and open. So do you remember with your 2 finger, you're going to protect the orbital rim, and also here because you don't want your solution to shift backward, or you don't want it to go towards the orbit. So now you're gonna feel for the pre-ostium. Yeah, that's a good place. 90 degree. 2-hand aspiration. Open your mouth. So when they open their mouth, it relaxes the temporalis muscle. So wait like 3, 4, 5 seconds. Just take your time, and then ease gently. Hold your needle with, yeah, perfect. No, that's perfect.
Also, fun fact for you guys that when you pull back on the pleasure,
0.3 should be fine.
so down to
0.3, yeah, 0.3, 0.3, like the whole thing.
Oh, the whole thing.
That's 0.3. You can keep your mouth
the
open.
rest of it?
Yeah. Go slow, perfect. Amazing. Good job, Elizabeth. You're killing it. Thank you. Awesome. And come out slow, When you come out slow, you're closing all the layers behind you. So it's like kind of like tamponizing the layer. So it's less bleeding, less trauma to the tissue. All right. Piriform fossa, who's the next? Next.
Yeah. Do you want this angle?
Yeah, I got you. Yes, thank you.
I'm trying not to get stabbed. Please don't mess your face up. I'm not going to. I'm making it better.
All right. So you could do 0.3, 0.4. So turn this way. You want to be mindful. The width of the chin, it should be the same width of the fatty part of the lip or the nasal ala. I'm seeing a lot of masculine chin these days that the width is almost the width of their lip. So be mindful. The female chin, it should be nice and pointy, nothing wide. So keep that in mind. Not Sculptra, no. And then the other thing with the female jawline is between like 100 to 120 degree. So we're trying to elongate the jawline. Versus for men, it's more like a 90-degree injection with the filler to make them more boxy. So almost their jawline is the same width of their cheeks, versus for the female, we still want to be mindful to maintaining the V shape for them. So yeah, for feel the angle of the mandible and straight to the bone. And then bevel down, and you can aspirate first. Aspiration, and you can do about 0.4 to 0.5. And if you don't, I always say, if you don't feel the bone, you don't want to inject. So make sure, is it clog or?
No. I'd already did it.
Perfect. All right, and you can clean
Do you do
that.
anything along the jaw?
Yeah, we could do that. And then now, since we have a little bit product left, now we can do the superficial, because you could do the superficial and deep injection together. Is this something you would do? Yeah. So for her, will be just more like the preorbicular area. So can I get a pen marking? Oh, here, marking pen. So like that, and then. So that's going to be more like a superficial. So you're under the skin, lift the tissue, pinch, yeah. And then nicely you're going to retrograde. Yep, that's a perfect dab. And push and pull and push and pull. Beautiful. Great work. And a great model. Thank you. Awesome. All right. So, so three linear thread. You have actually, and I have 1.5 here.
Okay.
Left of the tissue. And then your depth, you want to be making sure you're not too deep, you're not too superficial. That's perfect. And then between 0.1 to 0.2, push and pull back, push and pull back. And now you can reposition your needle. That's perfect. And then now really for your next injection, you can go to the little bit more like posterior. Yeah, perfect. It doesn't burn, it has the burning sensation. No, just. All right, so go ahead and turn this way. So she did the first one, so you can inject through the other, and then you're gonna lift the tissue. Perfect. Yeah, perfect. And then you're gonna put 0.1 to 0.2. Make sure you're retrograding. Push and pull back, push and pull back. And now same at entry level, you can reposition your needle. That's perfect. And if you want to come out all the way to do it again, whatever you're comfortable with. Perfect. And then that's exactly when we're going to massage. This is an area that we're going to like nicely massage for the patient.
And your entry point is here.
Yep, and bevel up. And if you're always like not sure, you can always check the depth of your needle. That's perfect. A little bit more, like just go all the way in. Yes. And push and pull, push and pull. And then you can reposition and give her one more bolus, a little bit more superior. So she can get the whole syringe. Good job. Yeah. Because a lot of us would lose so much, we lose so much volume in this region. And if you take a look, everybody, once they want to tell you what they want to look like, they're like, I just want some volume here. So this is exactly where they lost that volume. So we can really give them that volume loss from there.